guys, we are live from the Spiro Clinic in Fayetteville, Arkansas, and this is sort of a last minute deal. We wanted to see how this works. I was at the Burning Limbs First Conference in Cincinnati this weekend, and afterwards I had time to really sit down, literally sit down on the steps of the stage and visit with patients and hear the stories that really touch me and drive me. And so I love interacting with you guys, and I want to be accessible so that if you have questions, you always want to speak, to the doctor that's going to treat you and not have to go through all these other people to get to that person. So I want to be accessible on many levels and give as much information as possible for these conditions that I truly have a heart for treating. So I know we've had quite a few questions. I'll start off with the one from Australia. We have Kaylee behind the camera, and she's fantastic. She will be reading questions to me. If you have questions and questions based on what I'm saying, please just type it and tell us where you are watching from. We would appreciate that. And so who asked that question from Australia, Kaylee?
Sorry if I don't pronounce this correctly, but her name is Nargis. Nargis.
Nargis?
Yeah, or Nargis. And she just wants to know if it's not an immediate possibility for her to come to the clinic. Is there anything that you can recommend in the meantime, or do you know of anything locally in Australia?
I remember this question because I read it, and I know that you said your next step is a spinal cord stimulator. So, first off, let me say that I understand you guys are desperate for any relief whatsoever, and so I have a big heart for that. I understand. However, that being said, spinal cord stimulators is one of the fastest growing medical devices being put into human bodies. It's one of the least researched, and it's being fast-tracked by the FDA. There is a whole documentary about spinal cord stimulators and other medical devices. I think it's called The Thin Red Line on Netflix. Kelly is nodding yes. So if you can watch this. You are certainly 100% responsible for anything that's implanted into your body. So you better research it to death. I am not personally a big fan of spinal cord stimulators just because very often it will spread CRPS. If it does help, it's minimally so. Now you have a foreign body right close to the spinal cord, and I don't care what they say, that does cause some interference. Now, I'm not saying never ever. Has there been anyone that had some relief with them? Yes, but if you ever do get to the point where you want to get to the cause of your problem, the spinal cord stimulator certainly makes our lives more difficult. We have a patient that's having one being removed this month. Natalie that went home is having hers taken out. So I cannot imagine your position. You're in bed. You don't have the funds, but I do want to say that we have had patients that have climbed impossible mountains. Jo, that graduated last week, please go watch her video. She did 2 years of fundraising. So just because it's impossible today does not mean that it would be impossible 2 years from now. Get your friends on board, get your church on board, get your community on board, get the media on board. There are no centers at this time in Australia that I can tell you, go to that center. If it were as easy as picking up a phone and telling another chiropractor or doctor, follow this protocol, I would do it. But this is a very intricate system, guys. We use equipment, specialized equipment, many systems with equipment. Our staff have trained on the ground with hundreds of patients. So they're my eyes and ears and my hands where I can't always reach, and I cannot transplant our system. So your case is severe, and ultimately the best advice I can give you is to get here any way you can. And I'm saying this for your good, and I'm being as heartfelt as I can be. However, we had one patient, Kayla Hansen, who was not able to get better here at the time. She had the burn wounds on her arms from CRPS. It was really severe. And Kayla used ketogenic diet to pull herself, or she's pulling herself out of crisis mode. So a ketogenic diet, very heavy on fats, healthy fats, lots and lots of vegetables, and then healthy protein, grass-fed beef, healthy fish, stay away from farm-raised fish, is very, very advantageous to the nervous system. It may sound like a small thing, but really over time can make a big difference. And then you have to start moving again, little by little, millimeter by millimeter. If you give up and you give up movement, you are going to stay frozen and become worse and worse at the point where you are. I also want to mention the Burning Limb Foundation in Frisco, Texas. They have helped patients from Australia. They help patients really worldwide. They will not pay for your entire treatment, but they provide seed money. They provide a way for people to donate money where it's tax deductible, and they help you with ideas to fundraise.
Awesome. Okay, next question is from Julie. She says she's had CRPS for almost 5 years now, and she wants to know why weather changes cause her pain to increase, and why is it continuing to get worse?
So there are different schools of thoughts on this. Certainly you're not alone. Most CRPS patients, when we have a weather front coming in, will experience increased pain until we get them better here, and then we call that being above the weather. We even have a term for that. But one of two things, or maybe some of both, is that you actually develop bone cysts in the bone, and when there is increased pressure, that is going to put pressure on those cysts, which causes pain, or increased cerebrospinal fluid pressure around the brainstem and the vagus nerve, that will then increase your inflammation body-wide and increase your pain. Good question.
Okay, we have Carol. She wants to know, do you treat nerve pain even if it isn't CRPS?
Yes, we get these questions a lot. I think Kelly can attest. Do you treat purple monkey disease, or do you only treat CRPS? We are conditioned in the United States, certainly, to focus so much on the condition that we have, because that matters if you're going to take a specific drug and manage it chemically. However, our philosophy is we help the central nervous system to function better, work better, heal from within. Every single day, your body makes 222 billion new cells. If we can upregulate the recipe producing these cells, nerve cells, bone cells, then we can help your body to heal from within. So really, it doesn't matter where the pain comes from, or to some extent what it was caused by. We tailor our recipe for each patient. Philip Roberts' wife, Tracy, Philip Roberts started the Burning Limb Foundation, always says one size fits one. So I give her credit for this very brilliant saying. Each patient is unique, but we really don't care what the diagnosis is. And we have actually dealt with a lot of facial pain caused by different things. That's actually something I suffered from myself, so I have a lot of sympathy for the pain that she's in.
Okay, we have Liza. She wants to know, can all your treatments and therapies help if you still have a leg full of hardware?
That's a good question. Ultimately, I prefer a body without any foreign objects in it, but we don't always get our wish. And if you had a lot of fractures and now your bones are being held together by metal and they're sort of grown into the bone, it's going to create more trauma to take that out after a certain period of time. So is that ideal? No. Have we dealt with that before? Dozens and dozens and dozens of times. It doesn't mean that you cannot get better. We just have to add a few things. We have to make sure that you are not allergic to the implant, and then if you are, we have to help your body to cope with that implant better.
Okay, our next question is from Lexi. She wants to know your opinion on therapy and counseling, how important it is during CRPS treatment, and how much your mental health relates to your outcome.
Hi, Lexi. So that is a really good question. And here's what I'll say. I've had many patients get better without the counseling portion. Does it make our lives easier if you do have that? Yes. Each and every single chronic pain patient with these severe pain levels will have some degree of PTSD. And if you can get your brain on board with healing and a positive outlook, that certainly sets the table to make your chances of success much more likely. So when we build our new clinic that we're in the stages of planning right now, we're going to have an in-house counselor available to people should they need it. Certainly if you cannot make it to us for treatment or anywhere else, counseling becomes even more important, not just for you, but your support people around you, whether it's your partner, or husband, wife, parents. You guys carry a heavy burden, and counseling is super important. But I've had people get better without counseling, so is it possible? Yes.
Okay, we have one last question, a write-in from Instagram, and she wants to know, just in a snippet, what makes our program different and what is our approach?
Oh, where do I begin? So, traditionally, there's been the I don't want to say tried and true, just tried approach of approaching complex regional pain syndrome, EDS. So let's talk about some of that. There's ketamine. Ketamine is an animal tranquilizer that's dissociative to the body, meaning it is very mechanism is to remove the central nervous system realization from the body, disconnect your brain from your body so that you cannot feel the pain, which helps with pain in the short term, but it's not going to help your body heal because the brain absolutely has to communicate with the body in order for you to heal. Spinal cord stimulators that we already covered. We have physical therapy. Physical therapy by itself rarely will be enough, in my opinion, to pull a complex regional pain syndrome, EDS, patient through the really bad symptoms. The system that we use, let's start with physical therapy. We actually hook you up to a DC current. It will remind you a little bit of Russian stimulation, but it's not. It's a unique system. There is nothing else like it out there on the market. This machine encourages eccentric contraction. This is concentric contraction. All electric stimulation is going to want the body to do this. Eccentric contraction causes your body to open up, the sympathetic nervous system, the stress nervous system not to guard, and it allows us to do much more as far as fighting muscle atrophy, muscle gain, strength gain. And then also there's a way with the machine to go in and do what we call a search and destroy. We start with that. So we basically go and we search your entire body for areas of miscommunication where the brain isn't communicating with the body. We make sure from the tips of your toes to your brain that the electric signal, like a safety pin loop, is flowing and communicating, because that's the basic set for healing. I have a unique technique for vagus nerve stimulation that causes, often your pain will start dropping in the first week. It's gentle, and it is going to cause the inflammation in your entire body to start coming down, and your GI function, your food digestion, to become much easier. So if you have nausea, you cannot go to the bathroom, or you have pain when you eat, all those symptoms start turning around. We have a treatment that balances the brain. We have detoxification treatments. I can talk for 2 hours just about what we have found on blood work, because we've treated hundreds and hundreds of patients now, and so we know we're discovering some pretty startling things. We have a great testing lab here because we see so many patients and we approach the whole body, and we often see Epstein-Barr infections, chronic bladder infections, bacterial, viral infections that the body isn't fighting off well. The vagus nerve act as a ladder for those infections to climb up, then essentially infecting the vagus nerve and the white matter, the myelin around. It's like insulation around that nerve, and then that causes massive inflammation, setting you up for this chronic nerve pain. So you have to fight those chronic infections, and you cannot do it effectively with antibiotics and antivirals. They don't work. So we've developed our own recipe as to how to do that. We have scar tissue treatment where we use a German system where we use shock waves to dissolve scar tissue, because it interferes with brain-body communication, with how that nerve signal moves like a wave through the body, creates ripples. So if you have scar tissue that's left untreated, you will never reach your full potential. We have oxygen treatment, and this is the last thing. I'm not talking about everything, there's too much, but this is also a big thing that we're very excited about. We make your body think that it's being oxygen deprived, so we drop your oxygen level. And the reason we do this, you have very tiny capillaries, smaller than hairs, that red blood cells cannot move through to those affected limbs. And your red blood cells carry oxygen. Oxygen brings healing and metabolic processes to the cells. So that means your cells then, the plasma-rich oxygen can no longer enter the capillaries. So then these red blood cells start just puffing out, swelling, fat cells. And then it puts pressure on the small capillaries, so now it compresses it even more. So it's this forest fire feeding itself from within, where you have a lack of circulation in that limb. So we make the brain think that you're being deprived of oxygen, and you are. We drop the oxygen that you're breathing in. The body will react, the nervous system last minute, to massively force those capillaries open as a survival mechanism. And then we pump very pure oxygen into your body, getting it to those cells so those cells can start healing and dropping toxins. That's just a sliver of the system that we've designed here, so it's very complicated. And I have to say, the number one thing that makes us different is two things that make up the secret sauce of our treatment. My staff, handpicked every single one of them. I love them to bits. I'll eat around a table with them any day. They're my family away from home. They deeply, deeply care about our patients, and they're funny and passionate and very, very qualified. They're just unique people. And then the love concept that we promote within our clinic, where we encourage patients to bond. We have open treatment areas. We're breaking down all these barriers. We celebrate gains. Just this morning, we're going to post this video. We had a woman that's been in a wheelchair for 7 years walk for the first time. The entire waiting room broke out in applause. Those amazing moments, we celebrated together, we cried together, and that is very, very hard to replicate. I don't know of any other place like ours in the whole world.
We have 2 more questions.
Yay, more questions.
The first one is from Dana. She wants to know if you ever have any patients who relapse and end up having to do the treatment program all over again.
Very, very good question. People will sometimes say, well, you don't have 100% success rate. And I want to go, no kidding. We're not God. I'm not an angel. And it's a tough condition. So here are our stats. We've only done one formal follow-up questionnaire with our patients, but we were very strict on this because I wanted to know for me. We ended up communicating with 52 previous patients. I just actually added another 100% success case to this that is not part of the stats, so it's going to lift it a little bit. I saw her in Cincinnati. She's hard to get in contact with. But out of the 52 people, 27 people were still in full remission, 100% remission. There were a bunch of people that rated their improvement at 80 to 95%. Every now and then, if they walk a lot and the weather's really, really bad and they have a fight with their husband, their pain will maybe come up to a 4 instead of a 10, and they no longer take meds. Out of that group, we did have 7 people that fell below 30%. That's where our cutoff is, where we think, okay, to us, we're rating this as a failure. And then there were a bunch of in-betweens. Now, maybe I would say 4 times a year, we will have someone come back that did fantastic and then slip backwards a little bit. But usually it's not 100%. It's, I got, maybe 40% of my pain back. We have 2 people here right now, which is unusual. Both of them were 100% pain-free within the first 2 weeks of reactivating. So what we find is you don't have to do the program over again. It's just a refresher. And now we encourage patients to come back. We're making appointments for everyone in 6 months, if you're not from Australia, if it's possible, so that we can just touch base with you, see how you're doing on food allergies and things like that, see how you're doing on stress levels. So do we have 100% success rate? No, but our ongoing, over as long out as 8.5 years, our success rate is 84%. And that is pretty darn good for the conditions we're treating.
Awesome. Last question is from Catherine, and she wants to know, how does someone find out if they're a good candidate for your program?
So I have 2 people that, patient care coordinators, Kaylee and Anna, both speak with incoming patients. They both have extensive experience for what we really look for in patients, and when we think it's not a good fit, that will happen once in a blue moon. And so the first step is a phone call, and that number is 479-304-8202, and that way you'll speak directly. That is Anna's number. Kelly, do you want me to say your number? No, we're good. And so that's your first step. They will help you with the basics, the cost, what's involved, places to live, because we're an outpatient facility, more or less what you can expect, Monday through Thursday treatments, transport, restaurants, all of the things that seem really, really overwhelming.
I think it's also important to note that we don't require a diagnosis to receive treatment here.
No, because we don't tailor make your treatment based on your diagnosis. If you come to us and you say, I have pain that no one else has been able to help, we love hearing that. Those are fighting words for us. We love a challenge. We love to see results where everybody else have failed. So if you have some kind of pain that no one else has been able to help, then we're your people.
Okay, we're good. That wraps up all of our questions.
All right, guys, I just want to end and say thank you so much for watching this today. You may end up watching this afterwards. Post your questions underneath. If I am not answering it, one of my staff members will reach me no matter where I am, and we'll get your question answered for you. We are a fairly small community. I feel like we're making very big waves, but the most important thing I want to bring to you guys is a feeling of hope. Because when you're diagnosed and you go on the internet and you read what they're saying, you want to jump off the nearest cliff. There is not much good and positive on the internet. And so don't you buy into anyone telling you that you cannot get better. You keep fighting, keep your hope. Thanks for watching.